Welcome to World Medical School. My name is Davidson, and I'm a professor of global health and medicine at Boston University. I'm also the director of the travel clinic at BU. Today I'm going to discuss prevention strategies for chikungunya infections. So this is just a reminder of the major modes of transmission of chikungunya. This is primarily spread due to the bite of infected Aedes mosquitoes, primarily Aedes aegypti, but in some parts of the world, Aedes albopictus. Less commonly, it's possible to become infected through transfusion or through an accidental needle stick. And then mother-to-child transmission has been described, especially when a mother has acute infection during the course of pregnancy. There is evidence of vertical transmission. This is a study that's described here. It was a study done in Réunion during the large outbreak there in 2005-2006. So there are a number of different strategies for controlling chikungunya. Some of these include public health measures, in particular reducing mosquito breeding sites by emptying standing water from containers. And I'll say a little bit more about community mobilization in a minute. Screening blood products to try and prevent transfusion-associated infections. And then genetically modified mosquitoes, in particular Wolbachia-infected mosquitoes. This is a strategy that's been used to try and limit dengue transmission parts of the world, and basically infecting Wolbachia mosquitoes with Wolbachia, they're less able to transmit, have arboviruses, including dengue, chikungunya, and potentially other viruses. This has been mainly tried for dengue and not really used yet for chikungunya, but theoretically it could work. And then finally, vaccines, and I'll say a few words about those in a couple minutes. So this is a compilation of CDC advice, but basically the bottom line is small amounts of standing water, like the water you might find at the base of a potted plant, or in standing water, say there's used tires or other trash in a location. After the rains, there's just a small amount of standing water sufficient to allow the larva to develop for Aedes. So trying to control these breeding sites is an important strategy. And this actually is a good example. This just shows a number of different locations where Aedes mosquito larvae have been found. And so trying to remove waste, but also trying to empty breeding sites can help reduce the risk of infection. There's one study that was done a couple years ago in Mexico and Nicaragua. It was called the Camino Verde, or the Green Way. This was a cluster randomized controlled trial where they basically engaged communities. They educated them about the risk of dengue fever, and then they taught them about and they even showed them mosquito breeding sites around their homes and businesses. And they used a chemical-free strategy to basically get people in the community to empty standing water, to cover water that they needed, say for drinking water or other purposes, and then other strategies to try and reduce breeding sites for mosquitoes. And this was quite successful. It reduced dengue incidence in children by nearly 30%. It hasn't been tested for chikungunya, but because chikungunya is spread by the same vector, this kind of strategy could work also, but it requires intensive amount of effort with communities. In addition to that, for individuals, it's important to use personal protection measures. Now, although this was a flyer targeted for people for Zika prevention, all these measures are important for chikungunya prevention because the Aedes mosquitoes, Aedes aegypti in particular, are daytime biting mosquitoes. So being indoors in screened areas can help, but if people need to be out, then using effective insect repellent on skin, and then potentially treating clothing with insecticides such as permethrin can help reduce risk of mosquito bites. So a little more on anti-vector personal protective measures here. There are a number of insect repellents that have good activity against mosquitoes. DEET, picaridin, sometimes known as iccaridin in some countries, IR3535, and oil of lemon eucalyptus are all good products with a good safety profile and a reasonable duration of activity. For anyone who's using these at the same time as sunscreen, it's important to put the sunscreen on first and then the repellent, because otherwise the repellent can reduce the sunscreen protective factor by about a third. And I already mentioned that treating clothing with an insecticide like permethrin can be helpful. In addition to that, dark colors, strong smells, and carbon monoxide can attract mosquitoes. So the color of clothing can be very important, and avoiding perfumes and other strong agents that may attract mosquitoes. This is a little more on specific repellents, and I think rather than worry about the products here, because those are all on the U.S. market, I think more importantly is the active ingredient and the duration of protection. And you can see that about 24% DEET will give approximately 5 hours of protection. Other active components will be shorter in duration, and with DEET, it's really the duration of protection increases with higher concentrations, although generally you don't need much more than 25 to 30%. These are agents that can be used in children, although they must be 2 months and older. So these are guidelines from the U.S. Centers for Disease Control and Prevention, but also the American Academy of Pediatrics. And basically, both of these recommend use of DEET in children, infants that are 2 months and older. And they have a slight difference in terms of the maximum concentration that they recommend. CDC also recommends picaridin, pyrimethamdiol, and then IR35 as alternative options. So in addition to the personal protection measures, we now have at least one approved chikungunya vaccine in parts of Western Europe and the United States, and maybe even more widely at this point in time. This is a live attenuated vector vaccine. It's marketed under the brand name of IXCHIQ by Valneva. And basically, this was approved based on a surrogate marker of protection with neutralizing antibodies. And after 28 days, about nearly 99% of participants had neutralizing antibodies. This was tested in young and older adults, but not I think more recently they've been doing evaluations in adolescents, so there's not a lot of data yet in adolescents and children. Safety's been good. Injection site reactions are a problem. Headache, fatigue, muscle aches, joint pains, fever, nausea have all been described. There have been a few people that have had sort of persistent arthralgias for several weeks after the vaccine, and so we need to monitor this more closely because it is a live attenuated vaccine, and we need to understand it does lead to a viremia that's transient. These are more longer-term follow-up data showing neutralizing antibodies lasting up to 2 years after a single vaccine dose. So this appears to be a very immunogenic and long-lasting vaccine. Which is good because it means there may not be need for boosters, or booster intervals would be relatively infrequent. So this was approved, at least in the United States, in November 2023, and it was approved for adults 18 years and older. It comes as a lyophilized container that needs to be reconstituted for a single intramuscular dose. The major contraindications are people that are immunocompromised or anyone who's had a past allergic reaction to the vaccine. There are precautions for pregnancy and breastfeeding. I think that it probably would be best to avoid using this in pregnant women until we have more data on the sort of medium and long-term safety. And as I mentioned, there may be a very small risk of a prolonged chikungunya-like illness after vaccination. Again, there are phase 4 studies going on to try and assess how commonly this occurs and whether there are certain subsets of individuals that are at higher risk. So this is a summary of the ACIP recommendations. So this is a U.S. agency that provides recommendations for vaccinations. These came out in late February of this year, and basically they recommend for persons aged 18 and older that are traveling to a country or territory where there is an ongoing chikungunya outbreak. In the U.S., the CDC is collecting data and will declare an outbreak. So they're sort of the primary source. In Europe, the European CDC actually has a good sort of collection of data for chikungunya tracking, and that's an alternative source for information. And I think that there may be more in the future. The ACIP also recommended the vaccine for persons traveling to a country or territory without an outbreak, but with evidence of chikungunya transmission among humans within the last 5 years. In particular for older individuals, those with underlying medical conditions, or those that might have a moderate exposure to mosquitoes. And then anybody who's going to be planning a longer-term trip, either a longer-term trip or repeated trips to areas, say, such as India, where chikungunya outbreaks occur nearly every year, they should be considered for immunization. In addition to the live attenuated vaccine, there is a chikungunya virus-like particle vaccine that's under development. And this is an aluminum hydroxide adjuvanted vaccine. It's being produced by Bavarian Nordic. Similar to the live attenuated vaccine, this is being developed based on its ability to induce neutralizing antibodies. And their initial studies show very good ability to induce neutralizing antibodies in adolescents and adults, including a good number of people over the age of 65 who are at higher risk for having more complicated chikungunya infections. Side effects are pretty minimal, mostly local side effects, and then some systemic side effects with fatigue, headache, and myalgias. All of these seem to clear pretty quickly. So in summary, for prevention of chikungunya, anti-vector measures on a personal level are important, as well as environmental approaches to try and decrease mosquito breeding sites. We do now have a live attenuated vaccine available in a number of countries, and should have a virus-like particle vaccine available before too long. And then one part of this is we need better surveillance to identify, as early as possible chikungunya outbreaks in order to make travelers aware of the risk. And honestly, in recent years, Italy and France have had autochthonous, that is local transmission of chikungunya. So there may be a role for vaccination in that context as well. So thank you very much for your attention and for studying with the World Medical School.